she had that bleed into that little area, it stayed about this thick.
Okay.
So,
now what is this causing? What are the side effects of this? What is this going to happen? How is it going to affect her?
it can cause weakness on her right side.
On her right side?
Right side, yeah.
Okay.
So if you notice that, then that would potentially be concerning. Obviously, if she started having difficulty with mentation or thinking, or severe headaches all the time, then that would be concerning. If she were to become sleepy, hard to wake up when she's sleeping, then that's concerning too. So the only thing we can do now is if she were to decline, go in and do the full craniotomy and take the bone flap out. And that's what we were trying to avoid doing. But
say that again. Taking the what?
Opening up the skull to drain the fluid out. But even if we did that, she could still reaccumulate the fluid. So I'm kind of inclined to watch this for a little while, get another CT in a few weeks, and then if it's getting worse, decide what to do. If it's getting better, keep watching it and letting it reabsorb. If it's getting worse, we could decide then on whether she would need surgery. So, but it's not cooperating. So, and that's kind of one of the risks with these when the brain doesn't re-expand, unfortunately. So.
So basically, let's see. So at this point, we're just gonna have to wait.
Yeah.
Follow up with CT scan.
We'll get another CT in about 4 weeks and see if it's getting better.
Meanwhile, just watch her as we did before.
Yeah.
Should we see any changes?
Right.
Call you right away.
Yeah. Let me look at the incision here.
How serious these?
Well, you do a good job covering it up.
She does.
Yeah, looks good. The incision looks good. Okay.
How serious is this to you, with Dr. Converse? Like from level from 1 to 10, having this much fluid in her?
On a scale of 1 to 10, I'd say this is probably a 3 or 4.
Okay.
Because I'm hopeful it won't continue to get bigger, but it's kind of proved us wrong before. So, we can't do the bedside drainage at all. That's not helping us at all, because we're trying to pull the blood against a vacuum, and that's just not working. So, I think anything short of a full craniotomy or full opening of the skull is just not going to get rid of it.
And this fluid stems from the brain shrinking, and there is a cavity there because the brain is shrunk, and it creates a cavity for the fluid.
Right. Well, what also happens is when the brain shrinks, there are vessels that run from the brain to the skull. And as the brain shrinks, it stretches those vessels, and they can break with very little trauma. Just even shaking your head can rupture those vessels, and it can bleed into there. So she probably had some low level of trauma, and it bled, and now there's just space there, and so the fluid stays there. So.
And that's where the fluid accumulates, because it has that space.
Right.
That is, and that fluid is like normal from any of us. Obviously, we have fluid in our.
No, it's the result of bleeding.
Oh, it is the result of bleeding.
Right. Yeah.
Okay, but there's no new bleeding, which is good.
No new bleeding, and it did decrease a little bit, so maybe it will keep decreasing.
Okay.
Little by little.
Okay.
I don't know. So.
Any other questions?
As far as the activities, should she be like watching her movements around? Like she wants to do everything like she used to, like cleaning.
Yeah, she needs to be careful.
Okay.
She needs to take it easy.
Can she wash, she's dying to color her hair. Can she color her
I
hair?
think that's fine. Yeah.
Okay. Mami, entonces el doctor, como ves en ese film, todavía hay un líquido, todavía hay líquido. No hay más líquido ni nueva sangre, pero sí se mantiene con el líquido que ves ahí al lado. Es por la misma razón que tu cerebro se ha achicado, entonces queda ese espacio para que el líquido se quede ahí. Obviamente los procedimientos que el doctor ha hecho no funcionan, ¿no? Doctor, what about all that blood fluid that came out last time that you did it with the catheter? I mean, did that decrease? Obviously,
A little bit, but more blood just fills in.
More blood fills in.
Not more blood, more fluid
More
fills in.
fluid.
Yeah.
Okay.
Yeah.
Because he has that cavity, that emptiness.
Mhm.
Entonces, aunque lo ha sacado, lo que se ha sacado anteriormente, ese espacio vacío nuevamente se llena con nueva sangre. No es que esté sangrando. It's not that she's
Nuevo
brain
líquido.
No,
It's just fluid.
fluid now. Yeah.
Entonces, pero por ahora vamos a monitorear. Va a mandar otro CT scan. How many weeks did you say?
4 weeks.
En 4 semanas, a ver, para comparar. Lo que sí dice que se ha achicado un poquito. Did it go from 2.5 to 2.2? Is
Yes.
that what I read?
Yes.
Se fue un nivel tenía 2.5 y ahora ha bajado 2.2. Entonces, hay un poquito menos, pero obviamente todavía sigue ahí, ¿no? Entonces el doctor espera que en 4 semanas, cuando te haga el otro CT scan, a ver dónde está, en qué nivel está. Pero por ahora solamente recomienda monitorear, porque el siguiente paso sería una operación. Te tendría que abrir el cráneo y sacar ese líquido. Pero tampoco no te promete ni nos asegura que haciendo ese proceso otra vuelta se va a llenar o no llena.
Le gusta el agua.
Yeah. So even if we do the surgery, if we were to come down to do the surgery, you don't even guarantee that it's going to
It can reaccumulate.
Entonces, con mucho cuidado, tienes que tener mucho cuidado, cualquier cosa, tienes que tener mucho cuidado.
Tienes que estar
Quieta, ¿no?
quieta. Porque dice, si así te movieras mucho, así te estás moviendo mucho, se puede sangrar.
So tell her to be
Se rompe un nervio por dentro y se llena,
calm.
erupta.
Any abrupt
Right.
movement or fall, she can
She can bleed.
bleed easily. Por ahora, como le dije al doctor, se te ve muy bien, no tienes ningunos síntomas que, como la vez pasada, que no tenías conocimiento, no te acordabas nada. Pero dice que hay que también ver que posiblemente si empiezas a perder tu movimiento del lado derecho, entonces esos son síntomas que tenemos que tomar en cuenta.
Si no te puedes despertar cuando te despiertas en las mañanas, si tienes dificultad despertándote, puede ser un síntoma también.
O si estás durmiendo mucho, si
Si
te da
duermes
mucho
mucho.
sueño.
Sí. Mucho, sí.
She's sleepy all the time. She sleeps good.
Ya, así estamos.
¿Algo más? Anything else? No? Okay. We'll wait
All
and
right.
see.
All right. Well, let me give you that.
Okay.
Have you give that to the receptionist at the front desk.
Okay.
And they'll order that CT and then we'll see you back in 4 weeks.
Okay.